what does one do when they have, toddlers or children with inflamed adenoids? Is surgery the right option for all of them? If so, when?
If the adenoids are large enough to produce significant obstruction, which means the child cannot breathe at night, is sort of struggling, snoring, the parents tell you that the child keeps on tossing and turning in sleep, tries to adopt a particular posture to try and breathe. Yes, definitely we would treat it conservatively initially, but if the problem persists, we would advise surgery, even in the age group of 2 to 3 years, 4 years, because it is affecting their general growth as well. There is a definite relationship between poor oxygenation at night and that snoring that happens, because they're also not getting enough oxygen during the night rest period. And it has definite implications as far as growth is concerned. The child's attitude, irritability, capacity to concentrate, all these get affected, and physical growth. Also, it leads to ear problems. So if a child really has large adenoids which is impacting quality of life, we would definitely recommend surgery.
Okay. The other point that, statistics show that globally we've seen the rise of recurrent respiratory infections post-COVID. So how does one treat those recurrent respiratory infections? Is it always treated with just, say, looking at the symptoms, waiting for them to die down? Or do you eventually need to start antibiotics? And if so, how often?
Antibiotics really should be used only when there is definite evidence of a bacterial infection. The patient has fever, is unwell, is producing sputum which is purulent. Not every person who comes with a cough needs antibiotics. And post-COVID, yes, because of certain changes that have occurred in the lungs, they may have persistent cough. Doesn't have to be treated with antibiotics. There are specific indications to say, okay, in this particular case, he's running fever, the counts are high, and then you would go for a treatment of the bacterial infection with antibiotics.
And for children, the same applies?
Same applies, yeah. There is a tendency every time the child gets a sore throat, give antibiotics. No, that's not really on. You monitor the temperature. Everybody has innate, resistance power, can overcome infections. So you have to give that a chance as well. You might give them symptomatic treatment, but antibiotics should be reserved only when clearly indicated. Otherwise, overuse of antibiotics, you would land up with people getting resistant infections and your antibiotics would stop working.
One of the statistics for India indicates that sinusitis is in fact more widespread than asthma, diabetes and heart disease in the country. What leads to sinusitis and what is the best way to probably resolve it?
Every time you get a cold, technically you will have sinusitis because the nose and the sinus lining is continuous. We talk about sinusitis as a disease when it starts giving symptoms like nasal discharge, postnasal discharge, feeling of fullness in the face or even headaches. That's when it becomes significant, and you have it in two parts. You have acute sinusitis, which can occur over a short period of time, and if it's with purulent discharge, fever, etc., pain, headaches, you would want to give antibiotics. Target the antibiotics according to what you feel is necessary, along with decongestion so that the sinuses are allowed to drain. And then you have chronic sinusitis, where people have an ongoing problem. Usually they have some basis. So a person with strong allergies will more likely have chronic sinusitis. Exposed to pollution, continuously working in a polluted atmosphere, more chances of chronic sinusitis. And what happens in this is that all our sinuses are producing mucus like your nose, and it drains into the nose with tiny holes, ostia, what we call them, channels. And when you have allergy or a virus infection or pollution, there is swelling which blocks these channels. So the sinus cannot drain, and that leads to sinus changes, chronic sinusitis. And if it doesn't settle with medication, then you have to go and operate on them. And now with the endoscope, the surgeries are far more delicate. All that you have to do is to go and widen the opening of the sinus, allow it to drain, and you can take care of sinusitis.
Okay. Make informed decisions with comprehensive analysis on the go.
Strengthen your portfolio with real-time market updates on the go. Create effective strategies with insightful expert opinions on the go.
Grow on the go with CNBC-TV18. Now streaming live 24/7 on YouTube.
For more news and updates, all you need to do is follow CNBC TV 18 on all of our digital platforms.